Thanks, Lee. And that's great just to, before we kick off formally, just to say the chat is open. So if you have any issues or questions or comments, feedback throughout the presentation, which is part of it, we'll have some Q&A in the middle as well. Feel free to pop that in there, and Lee's going to be monitoring that. So with that, I might formally start our 2026 supporter meeting. I'm Victoria Erskine, and I'm the communication lead with Equally Well Australia, and I'm joined by our team members Lee Cobb, Dave Peters, Russell Roberts, and Justin Chapman, as well as Shannon, who is going to share her experiences launching our Equally Well Advocacy Framework. So Shannon Harwood, who many of you would have come across. So it's an exciting day for us. Firstly, I would like to offer an acknowledgement to country. I'm coming to you today from Wiradjuri lands, and at Charleston University, we respectfully acknowledge the traditional owners and custodians of the lands on which we live and work together. Charleston and its staff pay respect to elders and First Nation communities and acknowledge the continuity of cultures, languages, leadership and knowledge systems that have come before us. If you would like to share where you're coming from today, what land and country you're coming to us from, we'd love to see that in the chat as well. So the lay of the land today is we're going to share some information with you about some new initiatives that are coming up at Equally Well, and give you the opportunity to experience some of the things we've been have been working in the background. Really excited to share with you some initiatives that are coming back. Our purpose today is to connect with our supporters wherever you're coming from and wherever you are. We're really grateful for your time. For those who are watching the recording, thank you for tuning in and following up with the work of Equally Well. Your contribution to this community is absolutely vital, and we really value the relationships we have with all our supporters, large and small, individual and collective, and we really welcome you here today to keep up to date with the movement and what's happening in our space and our mission to improve health equity and physical health outcomes for people with mental health challenges. So one exciting thing we'd like to share with you on that note is that our ambassador program is expanding. So in 2026, just recently, we are welcoming 4 new ambassadors to our program, which is really exciting. So Sean, Alexis, Donna and Jade represent a whole new community representatives and sectors in research, in youth, in Aboriginal and Torres Strait Islander communities, and as our occupational therapy ambassador. And we are very proud to have them part of our leadership and mentorship as ambassadors to Equally Well, and welcome them warmly to our community and the opportunity and experiences that they bring to be able to amplify in their own spheres of influence some of the work that is happening across Australia. And we also are really keen to have their perspectives bring back to the community ways in which we can engage with those particular groups, more specifically around issues and information that's affecting them. So we're really excited about that. And just as a segue, very soon, watch this space, we'll be launching our Young Emerging Leaders Ambassador Program. There's a couple of we're very overwhelmed and excited by the nominations that have come in for that, and we'll soon be announcing our new Emerging Leaders Ambassador Program too. So that's another way in which we're trying to engage with people across our sphere of supporters and motivate and mobilise ourselves to action. Right now, I'm going to call on Justin Chapman, who was the lead of a very special project here at Equally Well that began in 2024, which was our Call to Action program. And Justin, I'm going to hand over to you.
Thanks, Vic. Hi, everyone. It's a pleasure to be here, and so exciting to be able to give a little bit of background about this initiative, which started in 2024. So for those who are in attendance, the 2024 Equally Well Forum was a lived experience forum, and it was more focused on a consultation event rather than just a conference. So it was an opportunity for us all to get together and really work out the future and new ways that Equally Well can be working. Over 200 delegates from across Australia, including consumers, carers, clinicians, came together to elevate lived experience voices and develop a new national call to action. So that's what we were doing for a good part of last year, developing the call. So the forum was recorded, and I had the pleasure of going through all the recordings, listening to everyone's quotes, synthesizing everything that came out into recommendations and actions. The forum had a few panels and plenary sessions and facilitated workshops with dedicated scribes and contributions from a range of stakeholders. And then when we had a draft, we circulated it back to attendees. It was reviewed by the Equally Well Alliance. It was presented in a webinar. So that was the last or the one before it supporters meeting, just like this, where we were presented it and asked for further feedback. So that the resulting call to action was collectively owned as much as possible. So from that process, I won't go delve down too much into the findings because it's all about what's coming up and presenting the advocacy framework and other equally well activities. But the main things were about human rights and lived experience leadership. So these were described not as optional, but as foundational drivers of system reform. Translating rights into practice and ensuring that services can reflect real world needs that come from everyone from the ground up, consumers, community members, staff, policymakers, and everyone in the system. So the resulting call to action had actions toward equity and accountability for individuals, services, peak advocacy bodies in the sector, and governments. The focus is on coordinated multi-level change, and for that to happen, we need everyone involved to be working together toward a common cause. For government, it was about aligning mental health legislation with human rights frameworks to improve equity of access to quality healthcare. For services and systems, it was about strengthening workforce capacity across primary and specialist services. For advocacy and sector leadership, it was about elevating physical health as a core priority in planning and commissioning. And for individuals and communities, it was about actively advocating for equity in physical healthcare to support broader system reform. So it really highlighted that and helped to articulate the fact that we already know the problem, we have strong evidence and consensus, and what we really need now is coordinated action and accountability. And so that leads into some of the great work that the team has been doing, led by Shannon Harwood. And so thank you all for a few minutes of your time.
Thanks, Justin. That's great. And just to context set where we might be heading next. So I'd now like to ask the leader of the Equally Well Advocacy Framework project, Shannon Harwood, who many of you have come across, to launch and officially share with you the work on the framework that she has been leading. So welcome, Shannon.
Thank you. And hello, everybody. Today is the 20th of May. Today is the launch of the Equally Well Advocacy Framework, and I'm absolutely delighted to be here to be able to do this. This work's been a little while in the making, and I hope it's going to prove really valuable to a lot of people who are able to use it. Equally Well asked me to lead the project, and I'll just let you know that I'm a person with lived experience, and I've been working specifically in physical health and mental health space with the things that I do for a while. And it wasn't really a surprise to me that Equally Well asked someone with lived experience to do this, as lived experience is centered not only in the rhetoric, but in the actuality of what Equally Well does at each stage. But that being said, this isn't a framework just for lived experience. This is a Equally Well advocacy framework. And so I'll stop doing off the cuff bits that I hadn't thought about, and I'll just work with the slide I've got in front of me. And I think this is a great way to actually describe what we're trying to do in this framework. So when you look at the image in front of you, you can see that there is a little quite fast moving action man on the left-hand side there, which is the cover of the framework. And I've taken for the second image of this page, preparing to advocate, which is a section from a part of the framework as the framework moves through. The idea of this framework is very much not only preparing to advocate, but to act. So throughout the framework, advocating and action are tied together, because we can all act and we can all advocate from whichever part of the system we're in or involved with. Vic, if you could throw me to the next slide. So, a small organisation might prepare an advocacy framework outlining what they do, why they do, and the tactics and strategies to use to do that. Equally Well is not just one organisation. Within this framework, there's actually a provocative question, and it says, who is Equally Well? And the answer to that is that Equally Well is all of us. There would be no Equally Well without all of us. It's a collective impact organisation. So, as well as creating an advocacy framework that does go into tactics, strategies, why we do what we do, we really wanted to create something that brought people into the network of Equally Well so that they could join with others and amplify the work that they're doing. So, in that sense, who, what, and where, as Justin's just talked about the call to action, it's worth mentioning that this piece of work builds on that call to action. And again, it's for individuals, for services, for policies, for government, and of course for advocacy bodies. But it's more than that. It's for anybody who reads this framework to connect, to engage, to join with the Equally Well network, and then to prepare to go back out into the weekend with out into the world with resources provided by the framework and the pathways within the framework to advocate effectively and to act to make change in the world. Vic, if we could have a new slide. Given the fact that many different kinds of people are going to read this framework, it works on different levels too. So if you're not into a heavy text read and you were just to flip through this framework and look at key messages, and they are marked out as little key messages, you would find a really clear exposition of what it is that Equally Well is about. If you want to read every line of text, you will find a really quite thorough beginning foundational knowledge of what Equally Well is about. If you were to go down every pathway of every resource, you would then cover the whole of the Equally Well workspace from 2016-17 through to the present day. But the other thing you will find in this framework throughout it is that little action man, there he is again, the little icon action man there, of actions that you can take. And this framework is to enable people to prepare for larger coordinated actions, but within it, it's got little mini action breaks. So do what you can, where you can, when you can. I think sometimes it's impossible to know and easy to underestimate where, how, and why change happens. So some of the little mini action breaks that anybody could take, printing out a fact sheet, signing up to share your story, informing Equally Well of your latest publication, all of those small actions can have larger consequences that you will ever know. But by bringing them in and extending the reach of the network and extending the resources of the network, we grow this movement to improve physical health. The slide I've got on screen in front of you at the moment, again, yes, we are preparing to advocate with, and we go through almost like a checklist. So the numbers 1 to 8 and the image on the left-hand side there is a step-by-step process that you can follow. If you've got an advocacy engagement, or you're looking to create a new service, or to respond to the work of Equally Well in anything that you might be doing, where a funding agreement, whatever you might be writing. This acts as a checklist of things that you might like to go through, and each one of those points will link to resources further within the Equally Well network. So it becomes like a surface checklist. I also have an example in the framework where these steps will follow through, and that would look different in different advocacy engagements. I just included one in the framework. And then the framework itself leads you through a foundational level of knowledge on the key publications of Equally Well, the evidence base, the authorising environment, identifying solutions, identifying the problem. And as with everything that you see with Equally Well, identifying the solution, this is a solvable problem, is something that we can all focus on in our advocacy message. The scope of the problem is large, the harms caused are serious, but the solutions exist. And hopefully this document will be used by people at all levels to be able to put some of those into place. As we created this framework, we really obviously, we didn't do this in a bubble. We wanted to do this with some really good feedback from people who might use this framework. And we work pretty closely actually with quite a few members of the Australian lived experience community, the National Mental Health Carers, sorry, the Mental Health Carers Association and the National Mental Health Consumer Alliance and their state members. We did this for two reasons. The first, again, putting at the centre of the project the people that Equally Well is working towards, people who are affected by this problem, people with lived experience. And we did an event where we went to Canberra last year, and the benefit gained from that for this framework was just enormous because not only did we get to sit with some really senior advocates and policy advisors from the lived experience organisations that we met with, but we also got to sit with really experienced advocates. People working in those lived experience organisations have been advocates for a long time. So their views on what were needed in an advocacy framework to allow people to connect with the Equally Well movement at various levels of involvement or spheres of influence is strongly present when you go to the framework and read it. There is another reason that I wanted to do that as well. And when you look at the image on the left here of those numbers for 1 to 8, you might have noticed that there are slightly smaller circles in the green colour there. And this is because lived experience advocates face particular challenges that aren't faced by other people in the cross-sector health sector when they're doing their advocacy work. And we wanted to address those. So for anybody who's not coming from the lived experience sector who comes to this framework, there's a little bit of additional learning there too about what advocates from other areas may face in their advocacy work. So there's a little bit of upskilling if you're coming from allied health or service provision that you may not have been aware of that's might be of use to you as well. But it's something that now makes this framework fully able to be used both by lived experience advocates and by service providers, by those commissioning services, by people in government and policy. So that's it. I've taken more time than I meant to, I'm sure. But that's what the Equally Well framework is for. And it all leads down a funnel of how to advocate, and it all leads back again to actions. It will always lead to actions, the actions that all of us can take. And this is an aid and a tool to allow people to prepare for action and advocacy. You can see on this page an example of the key messages that I was mentioning before. There's one from Equally Well. Advocacy and action opportunities exist at every level. And one from lived experience. As you take your first step, speak to the people most affected by the issue. And you will see key messages from Equally Well and key messages from the lived experience community side by side through these documents. And you will see substantial key messages where they're exactly on track with each other. This is a solvable problem. The last section of I'll just go back one, Vic. Yeah, the last section of the advocacy framework is a list of actions depending on where you sit within the sector. As an individual, as a service provider, in policy, in government, for an advocacy organisation, or for any individual. And those actions are listed. So if you're wondering, what can I do? Please go and look at the last section of the framework. Lots and lots of actions where people can jump in and make a difference. Or perhaps you're wondering, I think this would be a great idea. I know it would improve physical health. I'm wondering how that sits with the Equally Well platform. Then against the actions listed, you will see these little numbers 1, 2, 3, 4, 5, 6. And these numbers relate to the consensus statement elements. You will find an outline of what the Equally Well National Consensus Statement is within the framework and links to it. And when you have a look at actions that you may like to follow, you will be able to rest assured that you will be acting in ways that are in line with that national consensus statement. And you can follow through the Equally Well publications from this framework too, right from 2017, the publication through to the call to action that Justin was talking about, and now the Equally Well Advocacy Framework. And then the next one, Vic, I'm sure I've missed lots of things because I could talk about this for a long while, but if I get across the idea that it's both for preparation and action and pathways into the Equally Well network, then I think you've got a rough idea. It's up there, it's live at the moment. You can have a look. I did this last slide because if you're like me and you go to our website and you go, I wonder where it is, then there it is under the resources tab, our advocacy framework. That's where you'll find us on the website. And thank you very much for listening to that. And I'll just open it up. So if anyone wants to ask me any questions or dig down into something a little more, I'd be really happy to chat about that.
Thanks, Shannon. That's awesome. We're so proud of that work, and congratulations on all the effort and energy and enthusiasm and creativity that you poured into that. It's been a pleasure working alongside you in all our ways to help it come to light. So well done. Congratulations.
Thank you. Well, it was a big
And
team effort. I think any of the
yeah.
team could have presented that, but it's been a joy to work and do it. It's been such a good experience. Yeah.
Oh no. And just to add that Lee's popped the link to the page in the chat. So if you don't want to navigate the website and want to just go straight to the page, we've given you a little shortcut. But it certainly is easy enough to find, we hope. But on that note, open, Shannon, yeah. If anyone has any questions or comments, Lee, is there anything that we could need to respond to? I can't see the chat, I'm sorry, from where I am. Nope. Albert's raised his hand. Hello.
Hi, good
Welcome.
morning, everyone. Can you hear me?
Yes.
Yeah, it's actually great to see a lot of familiar faces again. I just wanted to give a very quick feedback regarding the framework. For someone like myself who was doing a lot of advocacy work within Gold Coast Health in relation to improving the physical health care we're providing to our mental health consumers, I can actually say that that framework makes a lot of sense. I mean, just sort of looking at the eight different domains, eight circles, and like the little ones, it fits really, really well in, I think, everything I've been trying to do. So I think for someone who, is thinking about, making that significant change within the service, I think, yeah, in addition to the Equally Well framework, I think the advocacy framework is a really, really good place to actually start and just sort of provide that guidance to do fantastic work in effecting that change. Yeah, so thank you to yourself and the team for all the hard work that's been done.
Thank you very much, Albert. Because I'm really hoping that in the way that it relates people back to the Equally Well resources, this framework, I'm really hoping that, you'll have 5 people who read the advocacy framework and they're each looking at a different scenario in their own working or professional lives. And each of them might end up in a slightly different place within the Equally Well resources, but it will be the right place. And that they'll know that they're at the right place because they've been able to have a look at their advocacy aims by following those sort of 8 steps through the process of what do I need? What's the bit that I need here to do this well? Yeah.
Yeah,
Thank you.
and I think one last thing I was going to say as well, I'm not sure if this is a little bit late, but would it be possible for maybe reference of the framework, the Equally Well framework, to be included in that advocacy framework, because I think it's just so vital, it's so important, it's so useful. And if an advocacy framework has been developed, it'll be really good to just sort of encourage people to be mindful of the existence of another framework, which is quite holistic. I mean, there's a lot we're doing with that framework here on the Gold Coast. So I think, yeah, a lot of message needs to be put out about that particular framework as well. Thank you.
Thanks, Albert. I'll throw to Giselle. We've got just a couple more minutes for questions, but I can see Giselle's got her hand up.
Thank you so
Thank
much.
you.
Yeah, this is fantastic. I'm new to learning more about Equally Well. I engage a lot within the research space, and I mentor people in terms of researcher engagements to do research. And the NHMRC has just recently put out a huge new document about engagement and how to do that appropriately. And in some ways, I think this is super relevant to that space and moving forward with advocacy in engaging with researchers and making sure that consumers are really heard in the outcomes of research. And so I'm really interested in learning a lot more about this with regards to how better I can support that engagement. I do a lot of document writing for organizations in terms of how they should engage consumers, and I do a lot of background research and underpinning evidence for that. And I think this is highly relevant to that space. And so I just wanted to say, even from my side of the fence, like where I work, this is super relevant, and I just really appreciate it. Yeah, thanks.
That's great, because I'm hoping it's relevant for every side of the fence. And you'll find one of the little pathways of linkages within the document is to the researchers directory. There's obviously a research directory, but also the researchers directory. So I don't know if you're listed there. I haven't remembered, but you can be, and read the framework and you'll find a pathway to join your tribe of other researchers like you who are working in this space as well. And there are communities of practices for various groups of people, again, pathways through this document to find your tribe within the tribe. And
That's awesome. Thank you for those questions. I can't see anyone else's hand up, so we might keep moving. We've got a few more exciting announcements to make. And thanks both Albert and Giselle for commenting, and others. This is a living live document now where we'd love to see what you do with it. So to Shannon's point, we can't wait to hear more. Please get in touch if you have ideas, feedback for Shannon or for the team about ways in which you're using it. We want to see it out there and live and working. So we look forward to that coming in, which is a lovely segue. Shannon dropped in a way to participate in our movement is to participate in our Share Your Story page. So I'm going to throw to Dave Peters, the co-chair of Equally Well Alliance, to introduce you to this brand new thing.
Thank you, Vicky. Look, it's something we have talked about since my beginning of the involvement with Equally Well back in 2018, 2017. Gosh, that's almost 10 years. Is the role that lived experience plays in emphasising and articulating, I guess, the true meaning and the impact of the situation of unaddressed physical health concerns, shortening lifespans and causing early mortality. So why are we talking about sharing stories? It's really so that we can talk about the issues and the problems. That's something that anyone can do, but hearing about it from the people that it most impacts and hearing from those people in a way that makes it personal, really, it's an incredible, powerful way to highlight the depth and devastation that happens when lives are cut short, when you know that can be prevented. But it's also, for me, a timely reminder that there are actions and things that I can do within my own sort of sphere of influence to make things better. There are actions and choices that I can make every day that can help reduce the risk of heart disease, or go off and be proactive with my medical team to make sure that I get those regular screenings. So it's a reminder, I guess, when I'm sharing parts of my journey and my focus and what I've done in my time with Equally Well. It's also just a way to remind me that, hey, I do know some things that I can do, and there is some power that I have that can help make things better just for me as well as everyone else. So we'll talk in a second about some of the tools that I've certainly used in the past and can be used to help plan and help, action sort of along the way. But it's really through the sharing of your stories that helps make this personal for people. We often talk in sort of the experience space around, not just being a story and sort of going beyond storytelling. And we definitely encourage that. And this is a way to leverage that experience and storytelling in a way that can make a really powerful difference. So, for anyone who might be considering sharing parts of their journey and talking about the ways in which acting or not acting has helped change their life in terms of their physical health and mental health, we'd really love to hear from you, because it's really through those stories that it helps us sort of talk and emphasize just how important this work is. And we couldn't do it without us, without anyone who has their own personal story or journey. We don't want to do it without us. So the it's, I guess, part of the strength of partnership. We don't rely on just being an organisation at the top that does everything and expects everyone else to carry along. This is an organisation built on a foundation of supporters that it's called collective impact, and it's an approach that relies on everyone to do what they can, where they can, and when they can. And yes, my picture there on this page is including my new puppy, who is 16 weeks old and chewing everything. Including my hands. But so really, back to this, I guess the sharing your story is part of capitalising on that opportunity to not just share what it means to you, but also help tell everyone else why this is so important, and just remind our funding bodies, our partners, medical services organisations, professional bodies, fellow consumers and carers, that this is something that there are things we can all do, but it's also something that people need to be outraged about, because it's something that has such a devastating impact in our country and also around the world. So, this is both a bit of an unhappy reminder of the situation, but also hopefully an empowering, opportunity to share the things that we can do and the reason why we do it. So hopefully I haven't gone over time there, but it's just a brief, I guess, recognition, celebration of the opportunity to share stories, and we really want to hear from anyone who's interested. Part of, I guess, another side of that partnership comes from the partnership with our professional members and networks of both funding bodies, governments, and organisations. And this fact sheet you're seeing in front of you is one of those partnerships in action with Central Eastern Sydney PHN, which is the Primary Health Network. And this is something that they approached us. We're already sort of in close collaboration with them already, but they and a number of others approached us to customise and sort of tailor one of our existing sort of resources to best suit their audience and their platforms and their sort of opportunities to share and advocate for their consumers and their constituents. So this is something that, in working closely with them, we were able to tailor and customise the fact sheet in a way that makes it more personal. It's not just a national statistic and a national outrage. This is something that is directly impacting the people that we work with and we fund and we hear from and that we serve. So hopefully this is an example, I guess, that gives other people ideas of ways that they can capitalise and that they can, ask us to work with them to tailor what we have in a way that makes it best suit their organisation or their network or their platform. So really, this is just another great example of the strength of partnerships, and it's something that we rely on completely. We're a small team, but we work really through our partners and through that collaboration and cooperation with our wonderful supporters and partners. So please, if anyone else wants to approach us to get some tailoring going on, we'd be very happy to work with you on that. And obviously, we continue to update all of our own resources as the years change and new data comes in and new evidence to support plans of action. But yeah, I just wanted to share this as really exciting, sort of happy and recent example of just how wonderful that partnership can work when we do work together. All
Thanks,
right.
Dave. That's awesome.
Thank you.
Thank you. And to that little segue, continuing on the theme of partnerships,
Yeah.
I'd like to call,
Well,
thanks, Dave,
you
on our
know,
national
interestingly,
director. Yeah.
I
Well,
was
and to your
I was
segue, go.
yeah, I was a NEMI consumer back when the health prompt was developed and launched, and it was actually this health prompt that got me involved in Equally Well in the first place. It other than my doctor, my psychiatrist, all the prescribers, and all the different medications, no one had ever talked to me about the physical health side effects and the risks that come with long-term use of medication. And the work with Nehemiah and this health prompt was what started in my journey of, oh, wow, okay, that's really, really bad. I could serve with some help and I could actually do some things to change that or, mitigate that risk. So thank you to Nehemiah. Without that opportunity, I wouldn't be here where I am with Equally Well. But also, it's a change of lifestyle, a change of attitude that this awareness and this opportunity of doing the health prompt gave me. So with that, I would very much like to welcome Maddie to come and talk about the Nehemiah Health Prompt update, which is something that we'd worked with Nehemiah to do in the last couple of years, or last year. It was just last year.
Yeah, it was launched in November. Thanks, Dave. Unfortunately, Maddie is
Oh,
not able to join us at the last minute, but stepping up to the plate is Russell Roberts, our National Director of Equally Well Australia, who also led this project. So, Russell, over to you.
Yeah, thanks, Vic. Unfortunately, Maddie's lost her voice, so you've got the B team today. You've got me and Dave. With your segue on steroids, you don't really need me to say anything, but of course I will because I'm me. Listen, this has been a great partnership between Nehemiah, but I think part of the characteristics I want to point out it's co-designed and it's evidence-based. I'm going to talk about a few of those things, and we'll go to the next slide, Vic. Um, and it's if you go to the website, we've got the area there, but we've changed the language. So the language is a language that's not blaming. It starts a conversation and it talks about the systems, really implies the system's obligation to make these things freely available. So too often the conversations with the mental health professionals and nurses and GPs and stuff, people feel blamed, like, why haven't you done this? Why aren't you exercising more? Why are you still smoking? This is a different conversation. The other thing I'd say is evidence-based. So in section 2, health checks and preventative care, those questions alone will cover 71% of all the premature deaths for people living with mental health conditions, just if you respond to that. And going a step further, there's 6 cancers which encourage people to have these 6 cancer screenings. If we ask that question and encourage 28 people to have those screenings, one of them, it will have a cancerous lesion or cancer. And for most of the treatments, the treatment success rate detected early is in the high 90s, 95% plus, a lot of them 99%. So people are dying unnecessarily because they're not having their cancers detected early. And instead of being stage 1 completely curable, 12 months, 2 years later, is stage 4 terminal. And this does not have to happen. And Dave, you talked about your experience with it. If we roll this out nationally, that would be the experience of thousands, dare I say, tens of thousands of people every year that there's an opportunity to save that many lives and protect their health. So this is a wonderful thing, I think, for conversation. And if the other thing about being co-designed, if we go to the next page, Vic, when you look at section 5, it says, what's important to you at the right now. And another one of the questions is like, well, and what support would you like right now? And it's person-centered and it's person-led. Only individuals and the people close to them understand their context. So yes, there's a lot of things that need to be attended to, but maybe I need to make sure I've got secure tenancy. Maybe I need to worry about being exposed to unsafe environments. So so a person is respecting the person's autonomy and agency to have an informed conversation. So it improves health literacy, but it also supports the person's integrity and personal autonomy. And fundamentally, that's one of the most important things we can do for people is to support their autonomy and sense of efficacy and self-agency. I'm going to move on to the next slide. So near my health prompt, this is fantastic. We're actually trialing this version in terms of implementation trial of this with navigators who are peers, and also navigators who are sort of established mental health workers. But Nehemiah are translating this. We're going to feed back the results from our research trial back to Nehemiah. So there'll be a revised refresh, probably in the middle of next year, based on the implementation trial. So we're really excited about this, and we know this saves lives, and Dave's just a testament to one of those. The other thing about that is we've partnered with a lot of service providers, and sometimes organisations have a overbearing bureaucracy. This is a conversation that clinicians and mental health professionals and health workers can have that's doable. But also people can take it themselves to the visit to the GP, or supporters can have that conversation. And once again, it's framed as not a blaming conversation, but a conversation about improving health literacy and opportunities to access free, readily available and free and affordable healthcare. Given the difficulties I understand with bulk billing GPs, but all the cancer services are basically free. So this has been a wonderful thing. There's the QR code. If you're interested as well, Lee, I know, will put in the group chat very soon a link to the launch of this, where the folks from Nehemiah launched this, and it's got a lot more background for that. It goes for about 15 minutes, that launch. So if you're interested more about the background and the development and what it can do, Lee will put that link to the conference presentation in Adelaide last year. Next slide, Vic. We're going well for time, so I reckon we'll have chances for conversations and questions at the end. So now I'm going to my stuff. Now I've stopped pretending to be Maddie, and now I'm Russell. Listen, we've got a lot of exciting stuff for the next 12 months. We are looking at developing an equally well implementation toolkit, and generally that's about helping, and we're going to work in partnership. So if you're interested in helping us think this through, it's working in partnership to say, how do we make the actions of the Equally Well National Consensus Statement real, in implementation land? And that means for consumers, carers, services, PHNs, NGOs, advocacy bodies. Like, how do we do that? And so, there's some elements like examples of what are some things we can do to protect people's health. What are some of the things we can do to detect, which might be, the protect is things like vaccination and lifestyle. What are some of the things we can do to detect early, such as some of the screenings we've been talking about with the health prop? What are some of the things we can do to connect better, to connect to the other services with GPs and PHNs and across social and welfare services? And what are some of the things that we can do to ensure continuity of care? And what are some of the things we can do to continue to advocate at all levels across the system for better, basically equitable access to health services? And this then sort of goes right back to the essential elements of the consensus statement, which Shannon's sort of linked back to the Equally Well Advocacy Framework, but also to the call to action. So all of these things are really coming together, but we're trying to give ideas and a framework and a toolkit to make this real on the ground. Scan of action, I'm going to jump over and leave that to the last. Also, just another partnership. We're working with Lived Experience Australia, a tremendous partner, and we're sharing the resources for increased awareness, and working with the Lung Foundation as well about the new free low-dose computer tomography for lung cancer, which is free for all people living with mental illness or all people who are long-term smokers. And a lot of people don't know about that. So we're trying to increase that, but also deal with some of the anxiety, particularly a trauma-informed approach to say, well, what's actually involved in that? So when people participate, they've got an idea what they're getting themselves in for. So really, we're working with Lived Experience Australia to sort of co-design some awareness resources. This year, we're not having a national conference. We're trying to get a balance between national and local. I won't quote a politician. I was like, have funded nationally, developed locally. But it is a little bit of a balance. So we're planning And I think we're actually starting to schedule a couple of these state-based workshops so we can think about how this might work across each jurisdiction. And so really trying to encourage opportunities to think where that state's up to, their context, and how we can sort of connect those local services. We're actually looking for volunteers to help sort of plan each of those. Primarily, it will be a lot with the state mental health services and the state consumer care services and the NGOs. But we just want to pitch that and work together as it's sort of a workshop and a forum to sort of progress the aims of Equally Well across each of the jurisdictions. And there's some super exciting stuff that's happening across the states. And the really, I think, interesting thing for me, it's so different. We're just having some very high level meetings recently, and I said, "Oh, what's some examples?" I didn't name the states, but there's some fantastic world leading stuff that some of the states are developing. So it's an opportunity to share that across the states, but also to sort of amplify and accelerate the work that's happening already within the states. Um, and on that, just a couple of other things. We're also developing an international scorecard. And what that's doing at the Global Leadership Exchange. And so Equally Well is an individual movement, it's a collective impact movement, but it's also an international movement. We're part of a, I think, fast accelerating international movement about health equity for people living with mental health conditions. And really what that first tranche is looking at is to what extent is the physical health in the authorising environment, in the policy environment. So national plans, national strategies, mental health plans, suicide prevention strategies, how much is this in that strategy? Because it really should be. And Australia's not doing too bad. I don't want to preempt the results. We're workshopping this in the next few weeks internationally, and then hopefully soon after that we'll produce this national scorecard. And the Equally Well Advocacy Framework, as I mentioned, we've just had a few high-level meetings today. And Shannon, you'll be very pleased to know I had the framework in my head as well. And Albert mentioned this, and it worked a treat, in terms of getting the connection, getting the attention of some of the real, state and national people who have their hands on the levers as well. And they're really great meetings. Because it's a great message. As Shannon said, this is a message of people's basic human rights are not being respected, but there's a solvable solution that has great outcomes for the population, but also for health services in terms of, reducing unnecessary burden on health services. So it's such a win-win conversation. So thanks, Shannon, for doing that work in the framework. Our next step, though, and Albert, thank you so much for your feedback, is actually now to try and frame up, like, okay, how can we sort of apply this and think about how we can work this into different contexts? So some of those might be across, of course, with consumers and carers, but also with PHNs and with state and advocates and researchers. So how can we sort of think about how we can frame it in a way that no matter what your context, you can sort of have the resources that you need. And that's really the toolkit, the resources that you need to present the arguments and have the, convincing, compelling conversations to really get people mobilised right across the sector. I skipped over scan of action, and I'm going to talk about that. Right now, we're just in, and we have that QR code. So please jump into that QR code and you can fill that in. But we will be getting in contact with all of our supporters to really update, say, what are any new initiatives? Because Equally Well is about highlighting best practice. It's a collective, and then sharing that with your permission, of course. So that's going out soon. But as we started, Equally Well is all of us. So if there's something that you're doing, we'd love to hear about it. If there's a new initiative you're thinking of or started, we'd love to hear about it. If there's a new opportunity or an idea, we'd love to hear about it. If you have a story that you'd like to share, we would like to hear about it. So the scan of action is a systematic way of doing that, but it's not the only way. So I'm going to finish up and then throw back to Vic, the awesome chair today. Thank you so much, Vic, and see if there's any comments or questions. We've got about 10 minutes to finish. Great chairing. Thanks, Vic.
You're welcome. No, thanks everybody. Before we just do that, I needed to acknowledge the fact that I overlooked because of my screen and sharing in too many windows. Sky Sharp, hello. Also, just acknowledging Sky's in the room and the front face of Equally Well for so many of us. So hi to Sky as well, who's joined us on the team call. Opening up to questions or comments or feedback, I can put it back on the slide before if you want to. Make sure you've got those QR codes activated. As Russell mentioned, we'll be following up with a detailed email to all our supporters with a physical link to the website of the Equally Well Advocacy Framework. We'll also include a link to give you time to process and think about what resources or activities or actions you might like to add to our 2026 scan of action to update our already quite intensive and extensive resource collection. But as we know that the impact of Equally Well is continuing to grow and change, and we know that people in our movement grow and change as well in different organisations at different times. So you might have not had a chance to even heard of the scan before. So we hope that if you haven't, that you jump in and have a look at an opportunity to contribute. And also you can check out our resources on our website currently to search for things that you might want to see examples of resources that you might like to, that will jog your interest in submitting your own work as well. Anyone else from the team got anything they wanted to add? Any questions? Nothing.
Vic, I might also
Go
flag
on.
that, Giselle's sort of linked to research. We are looking now to, and someone from the team might give us a bit of an update on this, quite soon send out some research snapshots. So, we're focused on the Equally Well fact sheets, which has focused on some of the areas where we can intervene and make a difference or contribute and advocate and make a difference. Now we're actually going another way, sort of just to have a snapshot of some of the best and most impactful research around the world that will, one, be of interest, but two, actually support your advocacy. And I think that the first one we're doing is some research just showing about the life expectancy gap. It's at 109 different countries, but the life expectancy gap, and also by the diagnosis of mental health conditions, which really says there's been a bit of a narrative that it's antipsychotics and people living with psychosis, and it says it's not that. It's probably associated with the stigma of any mental health condition, and so that's really quite profound data, because then that talks about high prevalence conditions. So this is an issue that affects 20% of the Australian population. There's no other group, not such a big minority, that has such poor, health inequities. So this is why we're so passionate about doing work in this area and advancing and reducing this health inequity for 21% of the population.
Awesome. Great. Well, if there are no further questions, everybody likes an early mark. We may give you 2 minutes of your day back, and I know it's a win-win, always a win-win at Equally Well. Thank you everybody for participating and joining us. We hopefully we'll have some more conversations with you, ongoing conversations or opportunities to engage. Ideas, suggestions, always welcome. Get in touch with us on the website, obviously, or to any one of us that you have contact with. And we look forward to seeing you all again soon. Thanks, everybody.
Thanks so much.
Thank you.
And thank you so much for your amazing work, team. You're just life-changing.
Oh, Joe, I need to add to you that the more stories are coming, and yours is one of them.
Oh, really? Oh my gosh. Wow.
Yeah.
I've got more to